So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. Hello, chat. How's everybody doing today? As Squishy Squid was saying, looks like a light topic for today. Yeah. Not so much. So welcome to another Healthy Gamer GG stream. My name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational or entertainment purposes only. And if y'all have a concern or question, please go see a licensed professional. So Axel Hose is saying, missed your streams. I missed y'all too. But also it was cool so we went to TwitchCon over the weekend. That was a lot of fun. It was really cool to like meet people in person. I think the one thing that has been disappointing about HG for me so far is that it's all been like on the internet, right? Which is cool. Like I understand that that's kind of the goal, is to make it on the internet, but it was really awesome to actually meet people and like hang out with them a little bit and talk to them and stuff like that. We did a interactive session on burnout, which was awesome and had so much fun. And as much as I love interacting with chat, like imagine interacting with chat in person, right? And that's basically what it was. And it was really fantastic. I really had a lot of fun. It was also great to hear people's stories. So as y'all know, we like to hear about people's stories. People will share their stories on Discord. Sometimes some of y'all will come on stream. We'll do call-ins. Y'all will post about it on the Reddits. So it was really awesome to like hear from people in person about, you know, how they're doing well, you know, what's going on in their lives. And it was amazing to see. I think for me, it kind of, I mean, like, I kind of know that there's impact, like, theoretically. So we get, like, numbers, right? So we'll get numbers that show that, oh, okay, so like, we're even, like, formulating a study, for example, that can watching streams or our YouTube videos actually improve in a statistically significant way people's mental health. So we do studies like this. Like, so we presented our first coaching outcome study at the American Psychiatric Association. So our initial sample size there was 1,300 for that study, but we've had over 10,000 clients. And so like we get this data, right? So like people get surveys and then they fill out the surveys and we measure things. And then it's like, oh, like we're making an impact. And sometimes I'll be walking around and someone will walk up to me and be like, hey, I just wanted to let you know, like, your stuff has really helped me. And I'm like, cool. Okay, so like we're sort of making an impact. But I didn't really like get it until I went to TwitchCon, that this community is absolutely amazing. And am I a part of it? Sure. Am I a big part of it? Sure. But I think that it's just so amazing what y'all have been able to do, what we've been able to do together. A lot of people, I was also really surprised. A lot of creators walked up to me and were like, hey, like, I've been in your creator coaching program for a while, or like, you know, people in our community will be like, I've done coaching and it like really, really helped me, changed my life, et cetera, et cetera. And so it was really interesting to hear actually like from people, right? Not like a sample size, not a scientific study of 1,300 subjects, but from real human beings, what impact we're making in their life. And also got to hear so many awesome shout outs to our coaches, because they'd be like, hey, like, this person has really helped me. I've been working with this person and this person and this person. And it was awesome. It was really awesome to see. So just a quick reminder. So first session on us for coaching is going to run for, it's almost over. So I think we've got about 200 spots left. So if y'all are interested in trying coaching, you know, that we're basically almost done. So you're welcome to sign up now if you want to sort of get in on that first session on us. So we're going to pay for your first session. Just to give you all a chance to try it out and kind of see what happens. Just keep in mind that coaching, we really do see good results like 8, 12, 16 weeks, but really 8 to 12 weeks is when we see statistical significant improvements in things like feelings of sadness, feelings of worry, purpose, confidence, things like that, more comfortable in social situations. So, you know, that window's almost closed. So be sure to sign up if y'all are interested in doing that. And yeah, for those of you that have signed up, it was great to talk to a lot of y'all. And it was really nice to hear, actually, because the other thing is like, we have data on our coaches, right? So we'll like track all kinds of outcomes. Like, okay, like what's the customer satisfaction? So for example, like, you know, 90+ % of our sessions are rated at 4.5 out of 5 stars. So we have like an internal process of like continuous improvement, but it's all like numbers. I don't know if that makes sense to y'all. Like, I see numbers. I don't see people. I don't see impact. I kind of like talk to coaches every now and then they go off and kind of do their thing and work with their clients. And then I'll help them with particular clients. So we've got a staff of people who will help coaches, you know, if they're trying to figure out, okay, how can I best help this person? And I teach each and every coach in our program in some capacity. But the thing is, like, I work with them when they're still starting out, and the more competent they become, the less I get to spend time with them, because I'm sort of focusing on our newer coaches. And so it's really awesome to hear like what they're capable of from the client in a way that I don't know that they're even like putting on a form somewhere, right? They're not like filling out a Google form or type form with the stuff that they kind of tell me. And so it was really awesome to see, you know, meet hundreds of people from our community. You know, I signed a bunch of stuff, which was cool, I guess. But most importantly, like, it was nice to like meet people and talk to people, which was fantastic. And I really, really hope to do that more in the future. So, yeah. So a couple of other things to think about. So we're doing something really cool. So Tech Teller and our mods and our community folks have put together yet another epic community event. And I really, really, really like this one. So this one is called Right in the Feels. And so for the next 6 weeks, what we're going to be doing is learning about and talking about emotions. So it's our belief that the mechanism of change that we create in this community is actually through EQ, or emotional quotient. So many years ago, someone realized that there's a general intellectual or analytical capability, which IQ, which sort of governs your ability to like problem solve stuff. And so we did a bunch of studying on IQ, which is essentially our reasoning capabilities, our analytical capabilities. And what we discovered was that, you know, there's this thing called IQ, and that it determines how successful or unsuccessful you are in some ways. because oftentimes people with IQ run into problems, and we'll get into that in a second. So many, many, many years later, we sort of discovered, hey, there's like a whole portion of the brain that is not related to IQ, which influences things like motivation and behavior. Because intellect does not have anything to do with motivation. You can logically know that you should get out of bed at 7 a.m. every morning, exercise for an hour, eat a bowl of oatmeal, and then do intermittent fasting for the next 16 hours. Like, you can intellectually know that. And so what we sort of discovered over the last 30 years is that intellect is insufficient at making people successful. And we see those people oftentimes in our community. These are people who are very, very smart, but like can't live up to their potential. And so as researchers were kind of looking into this, what they discovered is what we now call EQ. So if we think about what EQ is, it is the ability to recognize and become aware of what your internal emotional state is, to be able to communicate that internal emotional state, to be able to regulate that internal emotional state, and most importantly, to not let that internal emotional state impact your behavior. So what we tend to see when people are emotionally numb, so we'll use terms like alexithymia or things like that. There's also neuroscience research on addiction that shows that people who are vulnerable to addiction are more unaware of their internal emotional state. So a good example of this is when I work with patients, they'll say, yeah, everything was going great for a year, and then I don't know what happened, I relapsed. And the more that I work with people like that, and the more that we talk about it, what we discover is that there was stressor after stressor after stressor. It wasn't actually RNG. It was there's stuff piling up that the person was unaware of. And so as we become unaware of our emotions, they start to bleed into other parts of our life. So they can manifest as like all kinds of different things. Like they can manifest as jealousy, but we don't even realize it, right? We're kind of like, yeah, I don't want to go there. Why? I don't know. It's just not for me. So we use a lot of this vague language that actually like controls our life. Yeah, I'm just not a gym person. Yeah, like that's just not for me. So we'll like use all this vague language, but it's actually emotional unawareness. And what we've actually discovered is that by gaining awareness of our emotions, then we start to get to regulate them, right? And so what happened with me, I was completely emotionally unaware. And so I would wake up every day and I would be like, yeah, I don't feel like going to class. Let me start playing video games. And I'd play video games for 14 hours, 16 hours, and then I'd pass out. And like, I didn't realize that I was avoiding, I was afraid, I was ashamed, and that all of these emotions are controlling my life. Not only was I not aware of them, I didn't know how to regulate them, and I certainly couldn't keep them from controlling me. So those are the different EQ domains that have kind of been discovered and that we sort of work on. We also measure outcomes in our coaching program, for example, in terms of EQ. And so over the next 6 weeks, what we're going to try to do is just equip y'all with like information and knowledge and understanding of emotions. Now, this is a community-driven event, which means that it's not just streams and like Dr. K lecturing about stuff. There's going to be that too. So we've got a lot of really good emotional topics, like talking about emotional availability in relationships and things like that. But also like really fundamental stuff like why do we have emotions? But the really cool thing is that listening to lectures about emotions doesn't necessarily boost your EQ. What we're hoping for is that there's a bunch of stuff that we're going to do on our Discord and things that y'all can get involved in a community kind of way. So I'm going to just share some of that stuff with you right now, okay? So, there's what we're going to ask people to do is to like do different things like track your emotions, write journal entries, reflect on your emotions, engage in empathy building exercises, and do emotional regulation techniques. So we're going to target like all of that stuff in a very hands-on kind of way. Y'all can log on to feels.healthygamer.gg to participate. Journal entries, by the way, are completely anonymous. And then each week, also on the Discord, we're going to have an Ask a Coach event about particular emotions. So each week, we're going to cover emotions like shame, fear, anger, sadness, boredom, and happiness. So we're not going to cover all of them each week, but once a week, we're going to go through different emotions. And if y'all have questions and kind of want to explore that in a more interactive way, there's Ask a Coach. And then we've also got a couple of cool exercises. So there's Reflection Corner, where you get shown a previous journal entry and then you reflect on it. So like this is where we don't really get taught this stuff, right? But you can write a journal entry, and then reflecting on your journal entry is actually where the money is. It's kind of like if I want to get better at a video game, I can grind 20 hours, but it's probably better for me to climb if I play 10 hours and then watch my replays for 10 hours, right? That's when I actually get to see my mistakes and learn and grow. So we've got that going on. There's also empathy labs, which I think sounds very, very cool. So that's where we're going to anonymously show a journal entry, and then we're going to try to level up our empathy. So as we read a passage, what do you imagine that person is feeling, right? So this is where we literally, if you think about how do you train empathy? Well, let's take a look at a passage and see if we can figure out what that person might be feeling. And then we're also going to teach y'all practical techniques like meditations and other kinds of emotional regulation techniques. So I'm super, super excited about this because I think that the more that we're growing, the more we're able to do more stuff. So it's cool that we've got coaching. That's for people who are really willing to make a commitment of time and energy to make a significant change over their life over let's say a 12-week span. That's kind of like for people who are very, very interested and motivated to make change. Then we've got people who log into stream or watch stream or watch YouTube or whatever, participate in some way. And it's not like those people aren't interested in making a change too. And we've absolutely got something for people who are I want to learn stuff. I want to grow. I want to improve, but I've got a 45-minute drive each way to work. And that's the time the amount of time that I'm willing to devote. Totally fine. We're here for you. What we're discovering is that there's something in the middle, which is, okay, I'm not sure that coaching is for me, but I want more than just to listen. I want to start to be able to change. I want to start journaling. I want to start reflecting. I want to start acquiring some skills. And for that group, that's really where I think these community events are really powerful. Our Touch Grass event, for example, was really fantastic because it was all focused on getting y'all to go out and actually build something in your lives, right? So go out and meditate, go out and pick a piece of fresh fruit, go for a walk, go hiking, go look at nature. Go and do the things that we say you should do. And now we're going to really start with emotions. So we're going to dive over the next 6 weeks. I encourage all y'all to kind of tune in for all of this stuff. Both the lectures that we do on stream, the events that we have on Discord, and participate in your own way. And my hope is that at the end of the 6 weeks, we'll have seen a significant portion of our community have more emotional awareness, more emotional regulation, and more control over their lives because their emotions are no longer controlling them. That's really the goal. And the question is, can we actually make a significant statistical impact? Quick question I've got for Tech Teller. Do you know if for people who log on to Feels, are we collecting EQ outcomes? Do you know? We are not. Okay. So that's probably something that we should try to build out later, but we'll do that. But that we have to get, that's a process. That includes, if we're doing research and stuff, we have to go through the appropriate institutional review board kind of stuff. Oh, a 10% change is astronomical. So Wise Guy 315, great point. 10% change is astronomical. So I want y'all to think about this. So EQ is more like IQ. Right? A 10% change in your IQ is unheard of. Things don't boost your IQ by that much. That's what's really interesting about it. So you don't even need, even a 10% improvement is a huge outcome, right? So you can think about there's some situations where a 10% improvement is huge. So if I were to say, hey, this is going to increase your lifespan by 10%, that is wild. So y'all have to remember that when it comes to scientific measurement, some things, 10% seems small, but is actually gigantic. A 10% improvement in your income could be transformative. So with this EQ stuff, what we tend to see is that the other thing that's really interesting is that small improvements appear to be correlated with large changes in external life. So even a 5% improvement in EQ, for example, or 5 to 10% improvement in EQ is correlated with a 50+% or anywhere between 40 and 60% improvement in confidence in living your life. Is that wild? Like that's sort of an amalgamation of statistics and stuff that I've read. So what's really interesting is a small bump in EQ can be correlated with large changes in other domains. EQ outcomes means measuring change in EQ? Absolutely. Can EQ drop? I think so. Right? On the other hand, a 10% debuff of IQ is really easy. Yeah, so Namnai Mad is saying if I lost 10% of body fat, I'd be absolutely shredded. Absolutely. Gaming drops EQ, right? Sort of. So we're hoping that effect is temporary, but we do know that gaming leads to suppression of emotional circuits in the brain, which then leads to like a lack of awareness. Okay. SSR Cyber saying, hi, first time being here. Great to finally catch stream. Welcome. Okay. If people want to become a coach on your team, do they need any formal training? Nope. Wicked Biscuit. We do not. You do not. Wise Guy 315 is saying lack of social interaction is one of the major issues in EQ development. Completely agree. Right? So that's where like here at HG, like here's the question we've got. So along comes Wise Guy 315, who's the 315th Wise Guy on Twitch or in our chat, unclear. And he says, he or she says, I'm assuming it's a guy, but, you know, like lack of social interaction. So then the question is like, you're absolutely right, but what the hell are we going to do about that, chat? What are we going to do? Right? Like, I agree. And that's what's so awesome about Discord and community. Because we've literally got people social sandbox. So someone was brilliant, not my idea, by the way. And someone was like, hey, how about we actually teach people and give people the opportunity to practice social skills? Right? Because like the more we get disconnected, the more that we're texting and stuff. And there's a whole, and it's not just that we're losing social skills. We're also gaining a different kind of social skill, but we don't think about it that way because we're a little bit in the boomer mindset, which is like there's a whole symphony of an art and science of like how to text. What is the frequency of texting? How do you come across as confident but not arrogant? How do you let your needs be known without being desperate? So our brains are learning all kinds of new communication styles, and we're losing others. And so far, advancement in like texting and DMing doesn't seem to repair the damage caused by the atrophy in the other dimensions. Deli Carb is saying, I'm too anxious to join social sandbox. Completely makes sense. Right? So a lot of people are too anxious to go out and meet people. So we've tried to make it as safe as possible on social sandbox. The other thing is in social sandbox, you don't have to speak. You can go and just listen and just be quiet and in the corner of the room. It's the equivalent of sitting at the back of the class. Yeah, so that's okay. And that's also where like, so even if you can't participate in social sandbox and you're controlled by your anxiety, totally understand. No blame. Guess what? Some brilliant people in our community came up with a community event called Right in the Feels, where we can help you understand what you're feeling emotionally, give you exercises and stuff like that, and maybe even start to regulate or control those emotions. Right? Okay. Oh my God, people are still contributing to the cult totem. So let's go ahead and get This is the machine saying, healthy gamer, first time catching your stream. I watched like 100 hours of your content. It helped me an insane amount. Thank you. You're very welcome. And props to you for actually like, investing the time and energy to like make a change in your life. We're happy to, I'm happy that you found our content helpful. And remember that watching content isn't necessarily enough, right? We may be where you get started, but what you really get out of our content, what the multiplier on the content is going to be your effort. Okay. So now let's talk a little bit about, okay, so we do have a slightly, okay. Cataclysmic Cat is saying, hey, kind of new to stream, but I love watching your stuff and it's really helped my workflow with ADHD. Awesome. I'm really happy to hear that. All right. So we've got a slightly different topic today, and it's a little bit on the heavier side. So we're going to be talking a little bit about sexual assault. And more specifically, like what happens after sexual assault. So one of my experiences kind of as a psychiatrist is that people just don't know what to expect. And since they don't know what to expect, their ability to seek the appropriate support is very hampered. And the simplest way to put this is like, I had a friend recently whose kid went to the dentist for the first time. And when you've got a kid who goes to the dentist for the first time, there's a lot of anxiety, right? The kid doesn't know what to expect. And so if the kid had a choice, they would never go to the dentist because there's like a weird chair, and I've heard there are drills involved, and there are these metal instruments, and like, I have to keep my mouth, like it's like a very frightening experience. Even first haircuts can be frightening. And so if we really think about it, like, how do we help that child engage in the support that they need? We have to talk to the child. Hey, here's what to expect. I know you're scared. Everyone is scared. And here's the right way to proceed. And what I kind of noticed as a psychiatrist, I saw patients kind of in the emergency room, immediately after sexual assaults. But then I also saw people after sexual assaults like days later. So sometimes people would be hospitalized and like they'd come in over the weekend, and I show up on Monday morning for my job and they've been there for 3 days. I'd sometimes see people weeks later where, they thought they were okay, but then they'd sort of present to care because they're starting to having flashbacks or nightmares or things like that. And then I'd also see people months or even years later. These are people that may have been abused at some point or assaulted early on, and then a decade later, they're having trouble in their marriage or in relationships. So I've kind of seen people like all across the spectrum of sexual assault in terms of duration afterward. And what I realized is that like we don't actually do a good job of telling people like what to expect. And so what I'd love to do today is share some research. So it's not just going to be my opinion, but essentially like if you or a loved one has been sexually assaulted, what to expect? Like what is the process like? Because there's so many things about this that are hard to begin with. Dealing with the assault in and of itself in that moment is very difficult. But a lot of times what people don't realize is there are all kinds of lingering effects, which we don't even realize may be related to the assault. And then we end up blaming ourselves for. So for example, difficulty with sexuality or, sexual relationships or romantic relationships after an assault is very common. But 3 years later, what I've found when I talk to patients that I've worked with is they're like, I should be over it by now, right? It wasn't that bad. They'll say all these different kinds of things to themselves, which are actually like really devastating and harmful. So what I'd love to do is I just kind of in a very simple way, talk to y'all today about, first of all, like psychologically, what to expect after a sexual assault. It's not going to be like perfect because everyone is different. And that's one of the key things to remember. Another thing is sort of from a medical standpoint, like understanding what the process post-sexual assault is like so that you can make an informed decision or a friend can make an informed decision about why, when, and how to seek medical care. And then the third thing that I'm going to touch on, which is really well outside of my expertise, but I've had to learn some about, is sort of a legal standpoint. So if police get involved, what does that look like, et cetera, et cetera. Okay, so I'd like to talk to y'all about the psychology involving sexual assault, medicine involving sexual assault. And you may say, well, how are those things different? We'll explain. And then almost like a law enforcement standpoint. And the goal of this is just to equip y'all with some basic information. Because one of the things, I even remember seeing this in terms of therapy, where a lot of people are scared to go to therapy because they don't know what to expect. And one of the most useful things that I've ever done is talk to people about what to expect from therapy. Really nuts and bolts stuff. So you're going to walk into a room. It's going to be you and one person, and they're going to ask you some questions. If you have any questions, you can even start by asking, hey, can you tell me how this works? And so giving like really, really practical almost advice or orientation. And the thing is, sexual assault is such a private matter, which makes perfect sense. But then we don't, we'll educate people about like dangers, right? But we don't tell people what to expect. And so what I'd love to do in whatever little way that I can is share some of my experience and some data. So a couple of disclaimers. The first is that what I'm going to be talking about is going to be culturally dependent. So the resources and science that I'm drawing on are predominantly from systems from North America, the US, Canada, and the UK and parts of Europe. So your mileage may vary a lot depending on what part of the world you're in, but generally speaking, the UK, Canada, and the US have very, very similar systems, and that's what we're going to kind of be leaning on, okay? Another kind of obvious disclaimer is that we are talking about a slightly heavier topic, so if that's something that is uncomfortable for you, you're welcome to step out or pause the video or come back later or whatever. But my hope is to present some kind of very simple resource about telling people what to expect after sexual assault. So let's start with the psychology. So the first thing to understand about sexual assault is that people respond very, 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 very differently. So the first thing that's really bizarre is that 1/3 of people have almost no reaction to it. So I've worked, like everyone sort of assumes that sexual assault is a deeply emotional and traumatizing experience. And I'm not saying that it isn't, but what I'm saying is people experience that in very different ways. So I've worked with people who, for example, will sort of like, they're not even really like, they don't have PTSD or anything afterward. So there's evidence that not everyone gets PTSD, right? So let's just talk about that for a second. So there have been parts of the world that, people have experienced genocide. So this is a population of, let's say, 100,000 people who have a shared traumatic experience. And what we know from research is that some people are more resilient than others. Some people will be diagnosed with things like PTSD or chronic PTSD. And some people are actually like mentally healthy. If you like kind of screen them, even though something terrible happened to them, they're able to handle it in a more healthy way, and they actually don't get diagnosed with any illness. So that variability of human response is also true of sexual assault. I've worked with people who are able to acknowledge, they're like, yeah, it was bad. Like, yeah, it sucked while it happened, but I'm actually okay. I still feel okay with myself. I still feel loved by my family. I'm definitely going to learn some things from it, and it wasn't my fault. And they're able to kind of cope with it in a healthy manner. So it's really bizarre, but it really only 2/3 or 1/3 of people really report almost no reaction after a sexual assault. A couple of other things to consider. The first is that people underestimate how somatic or physical the reaction to sexual assault is. So I'm talking about days and even weeks or months, people will experience physical complaints. So sometimes this is really confusing for people because they're like, I'm not having nightmares, I'm not having flashbacks, I'm not paranoid every time I leave the house. I can leave the house, I can go to work, I can study, but I just can't eat anything. Anytime I eat solid food, I feel really, really nauseous, or I've had diarrhea for weeks and I have no idea what's going on. And so the first thing to understand is up to about half of people will have somatic complaints. So the primary response from their body is not psychological, it's actually physical. So there are stress hormones that are pumping through your body, and so it messes with your GI system, makes people's stomach upset. And I've seen GI upset and GI system related things to be the most common. You can also see flaring up of other chronic medical conditions. So you'll see worsening of things like autoimmune disorders and things like that. So you can sometimes almost have a physical manifestation. And let's remember that our body and mind are connected. So having physical problems after sexual assault is completely scientifically valid. Okay? So sometimes there are absolutely somatic complaints. Next thing is that in terms of the immediate response, we talked about how 1/3 of people don't really have any response, but it's also just as normal to experience all kinds of different emotional things. So the one very, very, very common experience is a sense of guilt or shame. That too is almost neurologically mediated. So we have this part of our brain that engages something called counterfactual thinking. And this is the part of our brain that helps us learn from mistakes. And usually when we make a mistake, we experience some amount of negative emotion with it. And that negative emotion is actually a motivator to change behavior. So if I failed a test and I didn't study, then what happens is my mind starts thinking, okay, what could I have done differently? And I feel a little bit ashamed for failing a test. And so then I start to think, okay, well, maybe what I should have done is start studying earlier. Okay? Makes perfect sense, right? In the case of a test. And so what we see is that after a negative outcome that is hurtful to us, we experience some degree of guilt and shame and start thinking about what we could have done differently. In the case of sexual assault, this can absolutely happen. And what we run into is something that's actually a little bit different, which is that in the case of sexual assault, it may not actually be our fault, right? But that part of our brain doesn't really know that. So in the same way that something bad happened to us, so I'm going to experience guilt and shame, and I'm going to think about what I could have done differently, that can sometimes cross over into feeling responsible. So this is where other people, and this is what's so confusing if you've gone through this, is you'll say, oh my God, let's say, heaven forbid you've been assaulted, but what I'll hear from patients is they'll say, oh my God, it's like, I shouldn't have been so stupid. And then what other people do is they'll say, oh, no, it's not your fault. It's not your fault. It's not your fault. Don't think that way. And those kinds of statements can actually be a little bit of a double-edged sword, because I agree it's not your fault. I think that's sort of factually true. And at the same time, what do you think that does for the person who's been assaulted? It almost makes them feel more isolated and less understood, because now I have 10 people telling me it's not my fault. And then I feel even worse because my brain is telling me it is my fault. So now not only did this thing happen to me, but I am so disconnected and everyone else is telling me that I shouldn't be thinking this way, which can make people feel even worse. So we see a lot of shame and guilt, very common reactions. We'll also see dissociation. So this is where sometimes what happens even during a sexual assault, and there's kind of lots of interesting neuroscience that explores this phenomenon, where you'll kind of unplug from yourself. So it almost feels like you're not living within your body, that your body is kind of like this robot and you're kind of watching it from the outside. So it's a very, very strange or bizarre experience. Chances are that is almost a protective, that's where my money is, that this is a protective neurological response so that you don't suffer quite as much. So dissociation tends to be triggered by traumatic events and helps people sort of gain distance from it. So it's very common for people to experience dissociation as well. From an emotional standpoint, what we tend to see is that the most common emotion actually is not shame or guilt, is not fear. The most common emotion that people experience after an assault is anger. So 59% of people will feel angry, which is also something that if you look at kind of like media depictions, when someone's like, anytime the media depicts someone who's been assaulted, they're withdrawn, they're quiet, they're kind of like, they're crying. And I'm not saying that those aren't appropriate reactions, but it's kind of interesting because the most common experience, and this is based on research, 59% of people feel anger. About 40% of people feel fear or anxiety. And the reason that I'm sharing these statistics with you is just to highlight that if you've gone through this, if someone you've known has gone through this or does go through this, for you to understand that if you feel pissed and you don't react the way that people in the movies react, and you don't react the way that your friends think you should react, that's actually totally fine. So what is the right reaction to sexual assault? Whatever you feel like. Obviously, I don't think you should hurt yourself or hurt other people, which, by the way, is an important thing to consider. So after a sexual assault, you do see feelings of increased suicidal ideation. So sometimes those feelings of guilt or shame or pain or numbness or dissociation can be so overpowering that people will start to think about ending their life. If that kind of thing happens, you should definitely get medical care. I think you should get medical care no matter what happens, and we'll get to that later on. But that is actually a relatively common experience. So that too is in a sense, I mean, it's not healthy, but it's normal. It's like it's a natural reaction. It does not mean that anything is wrong with you. The other good news is that usually gets better with time. So the other good thing that I really found as a clinician is that most people who experience assault are not screwed for the rest of their life. There are all kinds of problems that happen, but that even if you look at, for example, sexual dysfunction, so here's another thing that a lot of people will experience. After a sexual assault, they'll have difficulty engaging in sex. So this could be everything from difficulty getting aroused, right? So they're not as interested in sex, to physiologic changes. So sometimes, people will have difficulty getting an erection, or, women will have vaginal spasms. So like the entrance to the vagina, kind of those muscles will go into spasm. And so it's hard to actually engage in sexual activity for both men and women, or non-binary persons. So there are all kinds of changes that can happen in terms of psychologically, physiologically, and it doesn't mean that there's anything wrong with you. The other thing that's really interesting is that there's also difficulties, for example, achieving orgasm. So even if you are able to physiologically perform, your mind and whatever neurocircuitry is necessary to actually complete a sexual act may be kind of hampered in some way. So that too is honestly kind of normal. And it's okay. It doesn't mean that you're screwed in some way. And that's the reason that I really want to give this talk, is because so many of the people that I've worked with, not only does the assault happen, but all of the physiologic and psychological consequences make people feel like they're even more broken. They're like, oh crap, not only did I have to deal with this crap 1 day, 1 year ago, but now it's been a year and I still can't achieve orgasm. So the good news about this stuff, actually, is that it tends to resolve within about a year. So the majority of the research shows that sexual dysfunction following sexual assault tends to resolve within a year. There's also evidence, there are certainly cases where it doesn't resolve within a year, and that sometimes years later, some things can persist. So issues of safety, still difficulty with arousal and stuff like that. So a lot of it seems to naturally get better or get better with treatment over the course of a year. And there's a lot of stuff that can persist. The good news there is that even if it persists, if you engage in treatment, there's very solid evidence that shows that even if people have experienced sexual assault, chronic sexual assault, all kinds of things, we're talking about sexual abuse in childhood, that with tools like therapy, they can actually start to engage in healthy, meaningful, romantic, and sexual relationships. So I'm going to just pause for a second and make sure I didn't leave anything out. So a couple of other things. One is that the other thing I didn't mention about sexuality is that avoidance post-sexual assault is very, very common. So not just avoidance of sexual stuff, but avoidance of social situations, avoidance of even leaving the home. That's all really common. So it's not unusual for people to really want to avoid all kinds of stuff, whether it's their own emotions, whether it's romantic partners, whether it's leaving the house. The last thing to consider is that sometimes after a sexual assault, people will actually meet the criteria for an illness. So the most common are trauma-related disorders, no surprise. So people can sometimes develop PTSD. So PTSD is post-traumatic stress disorder, which is characterized by things like nightmares, flashbacks, what we call hypervigilance or hyperarousal. So you're paying attention to the environment. It's difficult to relax, things like that. And mood disorders are also really, really common. So people will get major depressive disorder, less so bipolar disorder, in my experience anyway. But you can sort of meet criteria for medical or psychiatric illnesses. And then you can also get treatment for those, which can get better. So I'm really optimistic that you can get better no matter what happened. So next up, what I want to do is talk a little bit about medical stuff after a sexual assault. And you may be kind of confused by that because you're like, well, you just talked about PTSD and mood disorders, right? What do you mean? What I'm talking about is what to expect from a medical standpoint in, let's say, the day to weeks after an assault. So one thing that I would recommend is if you don't know what else to do, just go to the emergency room or call emergency services like 911 or whatever the number is and where you are. And you can literally walk into, and this is what I really wanted to share is here's what's going to happen. What I want to do is just tell you what's going to happen if you get sexually assaulted and walk into an emergency room. So chances are what's going to happen, this is US based, right? But extends to other countries, is you're going to go in and then there's going to be an attendant and they'll be like, okay, what are you here for? And you can even tell that attendant, I'm here because I was assaulted. Then you're going to go into a room, probably a nurse will come in and check your vital signs. So in emergency rooms, when people come in, people have different levels of emergencies, right? So did you get shot 3 times and you have tons of internal bleeding? Or have you been vomiting for 4 hours and are able to like walk and talk, but like you really need to stop vomiting? Or did you have a nosebleed and you don't really know what to do? So the first thing that happens is you're going to see someone called a triage nurse. And a nurse is there to basically figure out, do we need to wheel you to an operating room for surgery? Or can you sit in a place for an hour or two and wait for a doctor to come see you? They're going to do things like check your vital signs. They'll check your blood pressure, things like that. And so you can just tell that nurse, and they're going to ask you what's bringing you here today. And you can just tell the nurse, I was sexually assaulted. All you got to say. And the nurse will take it over from there. So this is the key thing to remember. There are multiple medical organizations that span the globe, right? So the American Association for Emergency Room Physicians, World Health Organization guidance on medical care for people, victims of sexual assault. And all of these organizations develop guidelines and protocols. The goals of these guidelines and protocols are, first of all, to make you feel safe, okay? To a certain degree, to empower you. And I know that sounds kind of weird, but what does empowerment mean? Does it mean like, oh, like we're going to march the streets? No, empowerment means you were just attacked. What you want to happen, we want to happen. So you get to make the choices. And this is what's so difficult for people post-sexual assault is they feel so out of control. A lot of them hesitate to go to the ED because they don't know what's going to happen. If I go to the emergency room, does that mean that I have to go to court for the next 8 weeks and someone's going to be put on trial and I have to stand in a witness box and there's going to be cameras there and all that kind of stuff? Because no one ever tells them, no, that doesn't have to happen. It can happen if you want it to happen. So the goal of really medical treatment is, first of all, safety and empowerment. What empowerment means is that you get to make the decision. Other really, really important things about medical care. So other important things include making sure that there are not medical consequences from the sexual assault. So what they're going to try to do in this, and we'll get to illegal stuff in a second, is make sure that you're not hurt, right? So sometimes sexual assault comes with other things. Maybe you were physically assaulted as part of that. There could be different kinds of first aid that you need. You may have rashes, may have bruises. So we want to kind of take care of that medical stuff. And there are also two really, really important things that we really kind of focus on in the medical system. The first is protecting you against consequences from the assault. So that could be things like, giving you prophylactic medication to prevent sexually transmitted infections, because that can happen, right? So there's there are good protocols, for example, that if you get assaulted by someone who has HIV, maybe you have no idea who has, if they have HIV or not. But what the emergency room is going to give you, because heaven forbid, the last thing that you need is an STI after this experience. So there's even really good protocols that there's post-exposure prophylaxis for things like HIV. What does that mean? Post-exposure means after you've been exposed to a particular infection, you can take particular medication that will prevent the infection from actually working and infecting you. So post-exposure prophylaxis for HIV has pretty good outcomes. So that's the reason why I strongly recommend that people go to the emergency room, so you can get medication like that and essentially prevent as best as we can any kind of STIs or other consequences from, hopefully what was one bad experience and not longer than that. Other unintended consequences that we want to focus on are preventing pregnancy. So in the case of female victims, if that's important to you, depending on what contraception you're on or things like that, last thing that we want is unless you want it, of course, which you're the boss, is for people to get pregnant out of something like a sexual assault. So what we want to do as medical professionals, make sure you feel safe and empowered, protect you medically from consequences down the road. And the really sad thing is, unfortunately, I've seen people who don't realize, and we don't really expect them to realize, right? Because if you're let's say you're a 19-year-old and you're sexually assaulted at a party, the first thing in your mind is not, what kind of STIs could I get? People react all kinds of different ways. Maybe you're dissociating a little bit, whatever. The next thing that we do that's really important in emergency rooms is actually more medico-legal. So chances are this will trigger something that in the US we call a SANE exam. So SANE is, I forget what the acronym is. I'm blanking right now. So in other parts of the world, and we'll get to other acronyms in a second, but let me see actually if I have it. Yeah, I didn't include I'll figure out what SANE is. So it will trigger something called a SANE exam. So a SANE exam is something where with your permission, specially trained nurses, usually, there's a specific team that's involved. We're specially trained nurses who are like very trauma informed, right? So it's not going to be just any nurse or any doctor. It's going to be people who have gone through, saying a sexual assault nurse examiner. Thank you very much. People who have gone through a specific level of training and certification who know what they're doing will go through a series of steps with you. So these are not only to document injuries and make sure you're okay, do all that kind of medical stuff, but it's also to maintain a chain of custody for evidence. So they may ask to do particular things. So a SANE exam involves, so there's a SANE kit. In some places, it's called a rape kit. I personally like SANE exam more than rape kit because not all sexual assault is rape. But so they'll do different things. Like they'll ask if they can, remove, they'll bring a comb and they could take DNA from your hair or other places. There are swabs involved, things like that. They're going to examine you in different places if you're okay with it, make sure you're not hurt, give you appropriate medical care, and they will also collect evidence. Now, there's also, this is something that I want to highlight. So when a SANE exam happens, you have a really cool option, which is that you can choose to remain anonymous. So what they'll actually do is if you don't want things to go forward in that direction, what the SANE nurse can do is collect everything, but not attach your name to it. There's a unique identifier that you're given so that later on, they'll preserve the evidence, but they don't have to attach your name to it yet. If you decide a week later, a month later, a year later, hey, I decide I actually want to move forward with the legal process, that thing will be sitting and then will be processed appropriately. So this is really important to understand. Just because you consent to a SANE exam does not mean that anyone is going out and being arrested. Okay? It doesn't mean that you're going to wind up in court and you have to, skip a week of work so that you can accuse someone in court. The purpose is to really give you the stuff that you may need if you decide to move forward in a legal way. Okay? Now, I'm not a certified SANE examiner, right? So if there's people, I may be getting part of this wrong. This is kind of a combination of what I've researched as well as what I've seen. So for example, when I'm in a psychiatrist in the emergency room, I will help someone when they come in after sexual assault. But once the SANE nurse shows up, I will step out of the room and let them do their thing. I may connect with them afterward and say, hey, is there any stuff any medical injuries that I need to be concerned about? Or, how do you think they're doing? And then I'll step back in and talk to the patient if they're open to it. So we'll kind of emergency room folks will work with the SANE folks, but we call the SANE folks because they're the experts. Okay. So we want to maintain a chain of evidence. We want to make sure that you're medically okay. We want to orient you. The other thing that the SANE teams can do is also connect you with appropriate aftercare. So while I think it's a good idea for you to go to the emergency room, I think that's a good advice, recognize that you can get plugged into support after you leave. So let's say a week later, you do have an upset stomach. Let's say a month later, you are having problems in your relationship. Another really awesome part of the process is that what we want to do is give you resources and plug you in to additional things should you need them. So that's kind of a real important goal. And I've seen a difference in the people who get plugged in and can kind of start dealing with things as soon as they pop up, as opposed to people who are 3 months later, and I'm not blaming these people, right? Because it's hard. It's scary. And that's why we're making this video, because no one knows what to expect. 3 months later, they're okay, I'm having some kind of PTSD or something. And then they call someone and they schedule an appointment, and that appointment is 10 weeks away. And then 6 months have gone by. Now you've had untreated PTSD for 6 months. You're on academic probation, or you're on probation at work because you can't sleep at night because you've got nightmares, and then things become a lot harder. So I'd strongly recommend that people go and get medical care. We're really there to help. And the key thing to remember is that ultimately you're the boss, and we're going to do or not do whatever you want. There may be some really important exceptions to that. So for example, if you're acutely suicidal after a sexual assault, we're not going to let you leave the hospital. You may be hospitalized in that kind of case, but it's really for your safety. Generally speaking, 99% of the time, and by 99% of the time, I mean I may have seen 100 patients who are in that situation. I can only think of hospitalizing one. But the vast, vast majority, the goal is to keep you safe, empower you, and mitigate the damage that's been done, and sort of help support you in the next steps. The third thing that I want to talk a little bit about is law enforcement. So this is, once again, a resource that is a little bit the most outside of my wheelhouse. But it's important to remember that in law enforcement, hopefully, and I feel pretty good about this, by the way. I know that there's a lot of negative press and media around law enforcement. My experience with law enforcement around sexual assault has been overwhelmingly positive. Okay, so I trained in Boston, so that may have something to do with it because the law enforcement there is particularly good. But generally speaking, I do think that there are specific officers that, much like nurses, go through a special kind of training for sexual assault victims. And so this is called the SART, which is Sexual Assault Response Team. So if you call 911, the other thing that you can do in addition to going to the emergency room is you can walk into a police station. You can walk into a police station or call, the police hotline or whatever. You can do it minutes after the assault, days after the assault, weeks after the assault, or years after the assault. You can go in anytime. And when you go in, they're actually going to be, you just tell them, hey, I've experienced a sexual assault. In the case of the emergency room, sometimes the SART team is combined. So the SART team can include nurses. So the goal of the sexual assault response team is to have kind of medical and law enforcement stuff kind of work together to give the victim or the survivor kind of the best experience possible. And so they may do things like interview you and things like that. And the most important thing that I kind of learned by talking to some of my colleagues who are in law enforcement is that a lot of people hesitate to engage in law enforcement for reasons that their brain tells them. Like the assault wasn't that bad, or I don't have enough proof, right? Maybe you were assaulted and the person used gloves or used other kinds of things to where like you don't think there was DNA or like whatever. There are all kinds of reasons. Or another really, really common thing is that, the person was someone that I knew or was even in a relationship with, right? So I recently saw that there was a court in India that for the first time declared that sexual assault is possible within the marital relationship. So prior to this ruling, like there was kind of this idea that if you're married, like you can't be sexually assaulted by your partner. And so, there are all kinds of things that people will believe, like, if I got sexually assaulted by my husband or wife or whatever, that I can't report it because no one will believe me. And all of those kinds of thoughts, the officers that I've worked with, like they recognize that. And it's not, you shouldn't not go to the police just because you don't think there's enough evidence. Your job is to go to the police if you feel comfortable and let them worry about it, right? So don't worry if there aren't like visible injuries or anything like that. Those are the kinds of thoughts that people have. But it's actually completely okay to go to the police immediately after, a day after, a week after, and don't worry about the evidence or anything like that. They'll kind of do the best that they can and whatever, is appropriate in that situation. So the good news is that hopefully they have specially trained officers that are part of the SART. Be careful about some of the things that your mind may tell you. And generally speaking, I hope that you have a good experience if you work with law enforcement. My experience has generally speaking been very good. Okay. Couple of other things, just one last thing is speaking of people won't believe me or this is someone that I know. So 2/3 of sexual assault perpetrators are known by the victim. So that's where like a very common thing is this person is a part of my family or something like that. And oftentimes this is kind of going back to the psychological thing. A lot of times people will choose not to report sexual assault because paradoxically, they don't want to get people in trouble. I don't want to make a big deal about it. I don't want to ruin our family. And in the worst cases, the most traumatic cases, I've even seen family members advocate for that kind of thing where they'll say like, if you start telling everyone about this, it's going to tear the family apart. Like this person's wedding is coming up in 2 weeks, right? And that's where like, do I think that's deplorable? Absolutely. And also like, that's what I really want to explain about this process is that even if you are concerned about that, which you are allowed to be concerned about that, you are absolutely, like that's the whole point. It's not for outside people to judge what is right and what is wrong. That's the big takeaway. The cool thing about this process is that you control the speed and the timing. So this is the kind of situation where if someone came to me, like a friend came to me and said, hey, I was assaulted by a family member. I don't want to create trouble. What I would say to them is totally understand. If you don't want to create trouble, I don't think you should create trouble. But I still think you need to go get medically examined. And you can keep all the legal stuff anonymous for now, but I absolutely think you need to be examined by a doctor or a nurse. Make sure you're okay. You know, it's not my place to ask you questions like, when the assault happened, is there any exchange of bodily fluids? Like, you know, in the case of penetrative intercourse, was a condom used or not used? Like, that's not my role, right? But what I would explain to the person is, you don't need to go into the details, but I do think you should go to get medical care so that, like, if that kind of stuff did happen, that you can be appropriately cared for and doesn't have other kinds of consequences. And I'd also try to orient them to, like, you don't have to ruin any lives in the next 2 weeks if there's a wedding coming. You can just go through that process. It'll get stored on a shelf for a little while. They'll document your injuries. They'll take your statement, and you can just tell law enforcement, hey, I want to just, like, think about this for a couple of weeks. And then you can circle back and choose to press charges or not press charges or whatever. And generally speaking, that's been my experience in terms of you get to control the flow. Now, I'm not perfect. The system is not perfect. I'm not an expert in law enforcement. And if you listen to my advice and that doesn't happen, I deeply, deeply apologize. I'm not quite sure what to say about that. What I'm basing this on is my experience, as well as kind of the published guidelines. So kind of at the end of the day, one of the things that I kind of have appreciated as a mental health professional and psychiatrist is that patients don't know what to expect, right? Because, like, even if you look at, like, what we're taught in schools, they're like, okay, there's touching and there's inappropriate touching. And then, like, but people are like, okay, like, so if someone's inappropriately touching, what should you do? Okay, you should go tell a grown-up. Okay, fine. But then what happens? And what I tend to find is that a lot of people hesitate to reach out for help because they don't know what's going to happen next. Does this mean that people are going to post about it on social media? If someone goes and gets investigated, does that mean they're going to start posting about, oh, like, how I said all these things and I'm a drama queen and this and that? Like, you know, like, everyone is so afraid because they don't know what to expect. And so what I wanted to do today is just in a very simple way, tell you, like, a little bit of what to expect. A little bit about orienting, okay, if something like this happens that's terrible to you or a friend, here's what to expect. Even if you are the friend, recognize that you're not the one who went through the assault. So, like, the person who went through it gets to dictate the pace. If they don't want to press charges, they don't have to press charges. That may upset you as a friend, but that's their choice, right? They're the ones who have to go through the process. We can be as you know, justice oriented as we want to. And I'm not saying that you can't have a conversation with your friend, right? Or that justice isn't important, but ultimately, like, they're the ones that have to do it, right? They're the ones that have to go to the police station. They're the ones that have to talk to the police. They're the ones that have to get potentially interviewed and re-interviewed and press charges and hire a lawyer and go to court. They're the ones that have to go through all that. And some people just don't want to. Some people want to just completely forget about it. And honestly, like, as a physician, I think my first responsibility is, like, to the patient. And if that's what they want to do, okay, that's fine. If forgetting about it starts to cause you problems, which I've absolutely seen before, then my door is open, right? That's what I would say to a patient. That if this is what you want to do, that's totally fine. Is it okay if we check in a month? I just want to check in because sometimes people, like, change their minds. Can we talk about that a month from now? So let the survivor dictate what happens, because that's really what the system is designed for. It's not designed to railroad survivors into all kinds of stuff. You know, if this happened to someone that I cared about, my first and foremost point would be go to the medical emergency room, right? Get yourself examined, you know, get medication if you need for post-exposure prophylaxis. Like, those things are really, really important. Get that evidence collected. That's what I would kind of recommend. You don't have to act on any of it. But if you're unlucky enough to be in this kind of situation, I do think it's really important for you to get care. Questions? Oh, wow. I see a lot of really long things in chat. How was that, by the way? Yeah, I mean, I see long things. So how to support friends. So I'd say the most important thing, if you want to support friends is to follow their lead. So this is where, like, honestly, I've seen some pretty toxic friendships where one friend will impose their value system on the other friend. Like, I don't know how to say that, but like sometimes, like, honestly, I've worked with people, you know, remember, a third of people have no reaction whatsoever. I've worked with people who are like, yeah, it sucked. I'm going to be more careful in the future. Or it was like a random thing, right? And like, I feel okay. I went home. I made a sandwich. I woke up the next day. I took my dog for a walk. Was it a terrible experience? Yes. Do I hope it never happens again? Yes. And like, I want to continue living my life. This doesn't need to define me and doesn't need to occupy. I wasted 1 hour of my life with this event, and I don't want to give anything about this an additional hour of my life. I've met people who think like that. I've also met people who don't think like that, or dissociating, ashamed, guilty, suicidal. So I think the most important thing to do as a friend is to ask, how can I help? You know, and I do think like orienting them a little bit and sort of letting them understand that, hey, if at any point you want to engage in a legal process, then we do need to contact law enforcement sooner rather than later. So for example, something that people want to do immediately after a sexual assault is shower because they feel dirty. And I can't empathize with that because I've never been in that situation. But I sort of understand it intellectually. That like you feel dirty, you feel ashamed, you just want to wipe it clean. But if you do that, your legal options get vastly reduced. So just to have people understand that, and as a friend, like ask people, hey, are you open to like, can we talk about this a little bit? I don't need to hear details about what happened. I'm very concerned about the next 24 hours, and I would love it if I could help you feel safe and like do things that like will be protective towards you. What do you think about seeing a medical professional? Even explaining things like post-exposure prophylaxis, explaining things like the possibility of engaging in law enforcement, even these kind of tidbits like the SANE exam can be anonymous. So you don't even have to give them your name. So if you never want to claim it, you never have to. It's just going to sit on the shelf for some amount of time, then maybe get thrown away. Who knows? Maybe a decade later. But explaining some of these things will actually hopefully help people like get in the door. And then once they get in the door, I'd like to think that my colleagues will be able to do a good job, both on law enforcement and on the medical side. This is a fantastic question. So as a friend, follow their lead. And also if they don't know what to do, I think it's fine to explain some of these options to them and encourage them to seek medical care. Wow, dude, this is by far the longest responses I've gotten in chat. So it's just hard for me to read them. So Lady New York Recon is saying, how does someone get comfortable being intimate with partners again after something like this without feeling shame or disgust with themselves or needing to be under the influence just to get those walls down again? So really interesting question. So there's interesting data here, okay? The first is that sometimes using substances after a traumatic event makes it worse. So even though it'll temporarily help you, there is some evidence that the long-term outcomes can be worse if you use substances to like veg yourself out. Some evidence. On the flip side, there's also evidence that asking for trying to do detailed processing after a traumatic event does make it worse. Okay? There's also some evidence that doing some mild distracting activity, like there's actually a study on Tetris, where they had people who experienced trauma play Tetris afterward that found that it had a positive effect. So it keeps some of the negative thoughts at bay. So it's kind of complex, especially substance use and distractions and stuff like that. But having people go through the detail of, okay, like then what happened and then what happened and then what happened actually appears to re-traumatize them. So you want like a healthy amount of numbness. Now, the other thing is that for whatever reason, we just look at data, and it appears that most people who have sexual difficulties after a sexual assault, within a year, it just kind of gets better. And how and why does that work? Honestly, we don't know. So what we do know is that the body tends to naturally move towards homeostasis or equilibrium. And what does that mean? It's kind of like, okay, well, like if I ate a piece of fish and I got sick, the next day, let's say I get like a stomach flu or like food poisoning, I may avoid fish for the next day, the next week, the next month, but in a year, like most human beings will start eating fish again. So we just know that when humans are hurt by something, that over some amount of time, the body naturally heals. And so that can absolutely be the case for people who've experienced sexual assault. For a couple weeks or couple months, it's like hard. I don't feel aroused. I have difficulty, let's say with like vaginal lubrication or erection or achieving orgasm. I have those kind of difficulties. And just as time goes on, like it's really cool, but our body kind of heals. So that's very common. Now, for some people, it lingers for months, years, decades. And if that's the case, then I would strongly recommend, I mean, you don't have to wait a decade before you go see a therapist. I'd say go see a therapist right away. But we just know that sometimes things get better because that's how the human body is designed. It's designed to just kind of like keep going. And you know, that's where like therapy with these people is really to understand why you feel ashamed. Where is that disgust coming from? You know, like to validate those kinds of feelings that I feel gross after this, like, which is a very common experience, to feel disgusting. And to say, I can understand why you would feel that way. And then like, you know, sometimes, especially when it comes to like intimate with partners, like having a partner be a part of that conversation when it's the right time. Right? And there's all kinds of like intimacy building that can happen gradually and slowly with intimate partners. So when one partner says, I feel disgusting, and the other partner is like, you're not disgusting, that can be helpful, but it can also be like, okay, like if you feel disgusting, can I just hold you? We don't have to do anything. I don't find you disgusting. You know, I can understand that you feel that way. I'm so sorry that you've been through this, but like, it doesn't bother me. I think you're great. Not saying that you're wrong, but that's just not how I feel. Right? I respect you, love you, et cetera, et cetera, et cetera. Like there are ways to have those conversations and facilitate those conversations. And once you kind of do that in a healthy and persistent way, I've seen people be fantastic afterward. Right? Like back to normal. Or even in some cases, I know it sounds kind of weird, but you see this a lot when it comes to medical outcomes. Sometimes people are even better, right? So I'm not suggesting that we go through that because the vast majority of people are not better, but they just come back to normal is the most important thing. But what it really does is in some ways it tests the relationship, but it also like gives people an opportunity to really form a very powerful bond. That when a relationship gets through that, and when one person is feeling so disgusting and the other person accepts them, even though they feel disgusting, there's a level of like commitment and love that wasn't possible because I don't know if that kind of makes sense. Is like, if you like, the more disgusting I am and the more that you choose to love me anyway, the more love I can feel in a weird way. I don't know if that makes sense. Is that making sense to people? So I've seen that too, where like relationships come out the other side like really strong. Not saying it's easier that I recommend it. Right? So for it's not the person who's giving the love, it's for the person to realize, wow, despite how bad I feel about myself, this person still loves me. And that can feel like that's what unconditional love is. Yeah, so Cinder Squire is saying, I was one that could not achieve the big O with a partner in the room. Solo was fine. Audience participation was not. It took about 3 or so years of consensual activity before I had one with a partner. It's been gradually, consistently been getting easier since. That sounds like, honestly, a very common experience, Cinder Squire, and I thank you so much for sharing, because people don't realize that like it's kind of weird, but like we're not going to go into too much of a play-by-play, especially given the topic today. But like there are all kinds of things that you can do in a healthy, intimate relationship, even if you have difficulty achieving climax with a partner, right? There's all kinds of, there are different ways to play co-op, right? Right? So you guys can be on the same team and really be doing everything together, or like one of y'all can be the DPS and one of y'all can be the healer. And I don't even know what that analogy means. My point is that there are different roles that there are different ways that you can gradually move towards fun and intimacy and things like that. Right? Okay. So Cutie's asking, only one can win in co-op? Let me explain something to you. If y'all are playing a co-op game and there's only one winner, you're not going to keep queuing up for very long with that party. Let me tell you that. Sometimes there's just one winner, and usually those parties fall apart over time. If you want to keep queuing for a long period of time, you got to make sure everybody wins. And I'm noticing that the tonal shift is quite drastic. So, someone asked earlier about trust. So with trust, it just takes time to develop. That's all. Upsara AoE is saying, yeah, I've been in the one winner situation. That didn't last. It usually doesn't. And even in the case that it does, my condolences. Yeah, so Misocorny is asking a really good question, which is, what is sexual assault? So I don't know what the official definition is, but I think of it as any kind of sexual activity. It doesn't necessarily involve genitalia or penises, but any kind of sexual activity that is not consented to. So I think like even touching that is not consensual qualifies as sexual assault. Okay. So Ms. Kruthi is asking if you explained EMDR. I'm going to choose not to read too much into the fact that my wife is in chat. We're talking about one party winners, and she's asking me to explain a trauma therapy, which is her question. So I'm not going to read too much into that. But I have not explained EMDR, so I'll do that briefly, but we can talk. I think EMDR deserves its own lecture. Or course. So EMDR is eye movement desensitization response, maybe? I forget what the R is. And it's a very cool therapy. So it's an evidence-based treatment for trauma that I suspect is very similar to meditation. So in terms of the mechanism that it works. So we can talk about that later, but it's a good treatment for trauma because I think it like alters your state of consciousness to deal with the trauma in a different kind of way. Sus Queen is asking, quick question, EMDR still works over video therapy? I'm not sure. I don't know. I haven't looked at any papers specifically on EMDR and teletherapy. Okay, shall we move on? Can you acquire schizophrenia, someone is saying? Based on my understanding, schizophrenia is not contagious. So people will sometimes manifest schizophrenia, but I've never heard of a contagious schizophrenia before. but I don't know how to say this. No one is born with schizophrenia. So at some point they get diagnosed, right? So like, I don't think you can get it from someone else, but it's possible to not have it when you're 20 and have it when you're 21. Yeah, so we can talk about EMDR. I think that I have seen a high degree of variability in EMDR. So it's an evidence-based treatment, but I've seen some EMDR therapists that are like amazing and some that appear to not have great outcomes. And I've talked to some patients that will see one, try EMDR, and then see another and be like, oh, the second one was so much better. Okay, let's move on. Okay, so now we're going to do a different one. Oh my God, so bright. Okay. Let's take a look at these. So option number 1 is it normal to cry when you feel lonely? Option number 2 are my goals are incompatible with modern living. We'll do both. We've got 40 minutes, so we'll try to do both. What do y'all want to do? Can we get poll? Poll? Most people want 2. Easy. Easy clap. Easy clap, easy chat. Okay. All right. Let's see. Okay, voting. We'll let people finish voting. Tosalingor is saying consent discussion, please. I would love to do a consent discussion. It's something that I don't feel prepped for. So that's why we didn't include it. I'm not saying it ain't important. I'm saying that it is so important that it requires its own thing. And furthermore, I don't know if this kind of makes sense, but I know way more about what I just talked about than I know about consent. Does that kind of make sense to people? That's why we started with that. So consent discussions are very, 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 very important. Do I know a lot about consent? Sure. But if you look at clinical psychiatry and medical training, we see people after there's been a failure of consent. And so that's actually where we know a lot more. I'm also not sure that consent is necessarily a medical I mean, there is, of course, there's parts of like informed consent that are critical to medicine. But I also feel like I would need to draw on different perspectives as opposed to just medical perspectives to have a really good discussion around consent. Does that make sense? Informed consent is a great start. But I think that when it comes to consent in relationships, I don't think it maps on one-to-one with informed consent. The other thing that I'd want to do if we were having a discussion on consent is we may need an expert who is... There are aspects of this that are not medical, so I'd want to be sure to include those perspectives. Right? Am I wrong there? Like, isn't consent also like a legal term? Okay, okay. So goals are incompatible with modern life. All right, give me a second. Silent stream. Okay. Let's get started. So, alrighty. So let's take a look. My goals are incompatible with modern living. I've been listening to a lot of Dr. K's stuff lately, and something that resonated with me was the world demands too much of you. It's not just you. He emphasizes finding what your goals are, what you want in life. In another video, there were the quadrants of things people should do: shoulds, wants, duties, etc. He says if you stick in the shoulds, you have an empty life, successful or no. So what do you do when the shoulds are the only things you have time and energy for? I've discovered that my goals are all centering around one thing. I don't want to spend 8 to 10 hours a day doing what other people demand of me. I don't want to work. I have had the most fulfilling parts of my life when I'm between jobs, and I thrive in direct proportion to how much free time I have. I don't just sit on the couch. I do things. I do hobbies. I see friends. I volunteer. I exercise. But when I have to work, all of that mostly goes out the window because I need a lot of recharge time. No matter what job I've had, it always ends up this way. I don't get a choice to do my goals because I have to eat and keep a roof over my head. I'm horrendously jealous of two of my friends who got windfalls and are now living the life that I want. I see them weekly. It kills me inside. I hate work. I hate the very concept of work. And I'm so tired of doing the dog and pony show for a company just to stay alive. What happens when the world demands too much? Is the world demands you work? What happens when the should is so draining that you don't get anything you actually want? When the thing you're passionate about is freedom and a lack of obligation? So this is a fantastic post. And I love it because it captures, the first thing I love about it is that it's like a leveled up post. So this is someone who has watched some of our content, has already learned some stuff. And now we're getting to like the level 2, level 3, and level 4 questions. Okay, I'm with you. I understand that living a life that other people want me to live is unfulfilling. But I'm in a situation where what the world demands of me is not what I want. There just isn't space for what I want when the world demands something of me, right? And if we look at like the title of the post, my goals are incompatible with the world. What I want like just isn't possible. And there are other people out there who have what I want, and it is possible for them, but it's possible for them because they got lucky. And I know what's fulfilling to me. I've had periods of time where I don't have to go and slave in some job for 8 to 10 hours a day. And then I go out and I live life with zest. So it's not like life isn't enjoyable. Life is enjoyable. I like a particular kind of life. And that's not possible. It's fundamentally incompatible. And so let's think about this for a second, right? Because if what I want is incompatible with the world, how do human beings respond to that? If what you want is impossible, because you have to work, right? Like you can't just have freedom from obligations, which I totally get that you want. You know, I want freedom. I want to live my life. I don't want to live as some corporate slave. Totally get it. But this is the world that we live in. My goals are incompatible with the world. So what do you do in that situation? The natural thing to do is to be resigned, right? Because we can't wave a magic wand and change the world. So then it's like, okay, so like what? Are you telling me that if the world is a particular way and I have particular goals, what do I do about it? And what people will tell you is they'll be like, well, maybe change your goals because you can't change the world. And so then what we do is we sort of settle. We compromise. We're kind of like, okay, like, I guess I have to give up on my goals and become a peon and do what the world demands me to do, right? So what we actually like, when you want something that is impossible or feels impossible, what it naturally leads us to do is become resigned, to become resentful. And then it's like, then we're unhappy, right? And that's not that. To give up on my goals because they're incompatible in the world feels like sacrificing a part of myself. Why should I have to give up on my goals when it's incompatible with the world? Like, you're telling me just give up? So it leads to a ton of resentment. Resignation. We don't want to do that, right? We don't want to resign. Like, I don't want to give up what I want in life. Isn't the purpose of life that it should be fulfilling and, like, you know, I should be happy and I know what makes me happy? Like, why is the world this way? Makes perfect sense. So let's start by talking a little bit about the science of happiness. Okay? So let's talk science of happiness. So there's a great course on happiness, which is taught by a professor at Yale, which is anyone can sign up for. So they made it publicly available. Really cool. So they cover some research, which shows that, so what I'm kind of hearing from this person is that if they had freedom, if they had windfalls, like their two friends, then they would be happy. Because then I would have the freedom to do whatever I want. And what the research on happiness shows is that if this is, let's say, money or freedom, and this is happiness, that essentially, as we get more money, we become more happy. And then it either levels out or maybe even starts to decline. Now, this is confusing for a lot of people. So this number over here is 100,000 US dollars. But I think this was prior to inflation. I suspect that this number is actually 150K now. So when we say money doesn't buy happiness, well, sort of. It buys happiness. It buys a certain amount of happiness up until a particular point. And what I tend to see, and this is kind of weird, right? So like, well, doesn't more money buy more happiness? So let's look at celebrities. So celebrities tend to have a lot of money, right? So celebrities are like, in terms of their money or freedom, they're all the way out here with, let's say, net worths of $10 million. But they're not all perfectly happy. In fact, celebrities seem to be like some of the most kind of like, they have all kinds of trouble. And like a content, happy, and down-to-earth celebrity is such a rarity that the few of them that we see, we are like, wow, this person is so amazing. They're like a down-to-earth, humble, happy celebrity. The normal experience appears to be of celebrities that their life is like suffering that we don't understand. You'll get that? It's like once in a blue moon, they're like a desert rose. They're like, wow, that person is so down to earth. You see 1,000 clips of them on social media. Meanwhile, you've got like all these publications that are like, oh, this person is doing this. And we like love to hate on celebrities. They also talk about how much they suffer. Like, my life is hard. Right? And we're like, screw you. No, it's not. So if we look at it from a data perspective, we discover something really bizarre, which is that past 100 or 150K, maybe it stabilizes, but maybe even it goes down. And this has been my experience. So I've worked with a lot of people, some celebrities, but I've worked with a lot of people who are very successful. And I would completely agree that money to a certain point buys happiness. But what money buys is security. To a certain degree, freedom. And what it really buys is like freedom from worry. Like, it's really hard to be happy without a roof over your head. It's really hard to be happy when you have to worry about paying bills at the end of the month. It's really hard to be happy when you're thinking about going on vacation and you really have to like plan for months and months and months to be able to afford it. It's really hard to be happy when you go on vacation and things end up being 20% more than you budgeted for because you didn't budget for that and you had to work 6 months to get here. So all of those things, I completely agree, have to do with happiness. But what we also kind of know from a data perspective, right? So remember, this is research that shows that you can make, let's say, 500,000 and you get the same amount of happiness, or maybe even less than 100 or 150K, which is really bizarre. But that's what the data shows. And we sort of see that in celebrities. So this is where I'd say there's another thing here, which I don't know if this is, maybe starts like this, but this is what I would say is dharma or fulfillment. And there's data to support this as well. That our needs and security and money are kind of the white line, and they'll help us get so far. But beyond that, in order to be happy, we need something else. And so this is kind of what the Buddha said. So the Buddha was like, ultimately, happiness has nothing to do with money. It has to do with your attachments and freedom from attachments. We also see this with like Maslow's hierarchy of needs, where Maslow was kind of like the more of your needs that get met, the more self-actualization you need to be happy, right? And even now, if we look at it globally, something really interesting is happening across the world. Technology is advancing. There's more security than there's kind of ever been, right? And people may say, what are you talking about? There's climate change and the threat of nuclear war. What do you mean there's more security? 100 years ago, infant mortality was like 20%. Do y'all realize this? I don't know if y'all are from one of these cultures, because there's a lot of them, where they don't name a baby until they're like 20 days old. Like, think about what kind of culture doesn't name their children until they're 20. Happens in Indian culture. I think it may happen in Jewish culture as well. I've seen so many different cultures where they don't name the baby. And why is that? It's because a lot of them used to die. So 500 years ago, people were dying of starvation. Some of them are dying now. That's not good. But we lose more people from obesity than we do from starvation today. Right? That like cardiovascular disease and obesity and diabetes, this is doing more damage to us than starvation and poverty, which is really bizarre. So as a society, we're moving up Maslow's hierarchy of needs. And there's one dimension of medicine that is getting worse, and that's mental health. Everything else is getting better, right? HIV used to be a lethal diagnosis. People live almost normal lifespans if they get diagnosed with HIV today. Polio would cripple people and kill people. Any bacterial infection, before the invention and discovery of penicillin, has revolutionized survival. So for like 100,000 years, human beings were dying of pneumonia. And now, like, if you get a bacterial infection, you get azithromycin and you're okay. It's no longer a lethal illness. You just go to a doctor, they give you a prescription. Hell, in some parts of the world, you don't even need to see a doctor. You just go get antibiotics, you're fine. So as we're moving up, as a society, as we're moving up Maslow's hierarchy of needs, what do we discover? Mental health is getting worse because we're getting closer to the self-actualization. As a society, we are following this curve right now. And we've hit this point. And so now we're seeing people be more unhappy. Okay, so that's the kind of the first thing to understand. Now, the next thing to talk a little bit about, let's go back to the post for a second. So I've discovered that all my goals are centered around one thing. I don't want to spend 8 to 10 hours a day doing what other people demand of me. I don't want to work. I don't get a choice to do my goals because I have to eat and keep a roof over my head. I'm horrendously jealous of 2 of my friends who got windfalls and are now living the life that I want. I see them weekly and it kills me inside. So if we're talking about this, we need to understand something. So the first is that if you get more freedom, it will make you more happy up until a point. So I don't doubt that for a second, that like if you're working so hard that you don't get a chance to do your hobbies, you don't get a chance to exercise, you don't get a chance to socialize, I totally understand why you would feel unhappy. But the first thing that I want to point out is that the goals that I'm hearing this person say are kind of different. They're not necessarily moving towards something. You could kind of say they're moving towards freedom, which makes sense because that's a value that this person has. But what I'm really hearing is this person's goal is to not do something. And to me, not doing things and chasing something like freedom is not quite what fulfills people. Like, I don't know if that kind of makes sense because you can make an argument that, yeah, their goal is freedom. Makes sense. But what I'm really hearing from this person is, I want the life that someone else has. I want the life that someone else has. I see my friends every week. They got windfalls and I did not. And it kills me inside. And my goals are incompatible with the world. So if you really this is going to be tricky because now I'm going to say some things that I think in some ways may not be compassionate. But if you really want to know the answer to this situation, we have to understand some harsh things about the world and ourselves. The first is that if the world is a particular way and you are unhappy with it, you have far more power to change yourself than you do the world. Do you have power to change the world? Absolutely. But I'm going to go out on a limb in saying that if you want to change the world, you got to change yourself first. I'm not saying that the world is a perfect place and that it shouldn't be worked on. But if your goals are fundamentally incompatible with the world, I think you've got to look at your goals because those are way easier to change. Now, here's the problem with that, right? So if you tell me so I need to change my goals, right? But you don't want to change your goals. That doesn't feel fair to you. Chances are. If you're listening to this and you're like, ugh, but I want those things, right? I want freedom. I want friends. I want those windfall profits that let me live the life that I want. I'm jealous of these people. I'm envious of them. And so if I told you okay, so then if you're envious of people, maybe the solution is to no longer be envious, right? So let's say I said, okay, if you meditate for a while, you'll no longer feel jealous. You'll learn to be content with what you have because that is how you become happy in life. You meditate your way to contentment, right? We know that. Science and all that good stuff. Do you want to meditate your way to contentment? Of course not. You don't want to meditate. You don't want to be content. What you want is to have your desires fulfilled. When you're envious, if I gave you a meditation that you could do for 6 months, and at the end of that you would not feel 1 ounce of envy, would you actually do it? Maybe. But I'm guessing a fair number of y'all would not. And why is that? Because that's not actually what you want. You don't want contentment. You want what your friends have. Because to be content means to give up your jealousy. It means to give up your desires. It means to settle. And we don't want to settle. No. Because that's not what life is about. The road to happiness, you're telling me the road to happiness is fucking settle? You're telling me that the road to happiness is not achieving what I want? Those are my goals. You're telling me to give up my goals to be happy? How about achieving my goals? Why don't you help me do that? Because I don't want to give up my goals. That's giving up, right? It's resignation. It's resentment. So there are a couple things we got to understand about this. If you have a bunch of jobs and you say, I don't like any of them, I am incompatible with the world, there's a subtle issue there. So it's very possible that you don't like any of them. It's very possible that your jobs suck. I'm not saying that isn't possible. But anytime we're approaching a problem in life, there's a part that is the world and there's the part that's us. And how do you know that? Is a simple way to, I'll give you all a simple example. So I want you all to think about an Olympic silver medalist. The person who gets the silver medal, they're the number one loser, right? And they're also an Olympic silver medalist. Is that something to be proud of, or is that something to be frustrated about? Do you think the silver medalist envies the gold medalist? If I went to a silver medalist and I said, hey, you should be happy. You're the second best person in the world. That's amazing. You're better than 7 billion other people. Good job. And the interesting thing is, are there silver medalists who are like, yeah, I know, I'm very proud of my accomplishments. It's great. I'm happy for the person who got the gold. I wish I could have done it, but you know what? I worked really hard. I'm proud of it. And then there's the other kind of silver medalist that's like, you know what? You're right. I wish I got the gold. I worked so hard to just get a freaking silver. I don't care about the 7 billion people that I'm better than. I'm just looking at the one person that I'm inferior to. Do both of those perspectives kind of make sense? Can you imagine that both of those people could feel that way? Absolutely. but their situation is exactly the same. They both got the silver medal. So what's the difference? Why is one content and one is unhappy? It's your perspective. It's the personal attitude. It's not the world, it's you. So this is something that's really important to understand. Or do the jobs that you have suck? Maybe. I don't know. I'm not saying that they don't. But there is some element that you control over whether your jobs are the worst thing in the world or acceptable or even enjoyable. I'm not saying that you have 100% control, but you've got some control there. And if you're in a situation where you say my goals are incompatible with the world, you've got to figure out what you do control. So just to give you all a little bit more like kind of a scientific analogy. So there's this thing called the placebo effect, which means that if you believe that something will work for you, it clinically will have a benefit, even if it is completely biologically inert. And the placebo effect can be seen in chemotherapy drugs. So these are things that literally like kill cancer. And if you believe it works, it has a greater effect. The other thing that's kind of interesting is the placebo effect has a lesser known cousin called the nocebo effect, which means that if you don't believe something will work, it won't work for you. The therapeutic value of a medication that a patient does not believe in decreases, even if it's the same biological compound. But if I don't believe it'll work less. We can also see this in other areas like relationships. So the one thing that predicts happiness and the strongest variable that predicts happiness and contentment in a romantic relationship is faith in the relationship. Which may sound kind of weird because isn't the faith determined by the quality of the relationship? It turns out that at a minimum, it's a two-way street. If you believe in a relationship, that relationship will actually be better. Just like if you believe in a medication, that will be better. So I want y'all to just think about this. Let's say that I don't believe that I believe I'm incompatible with the people, with the world and dating. I'm incompatible. My goals don't line up with the people that in the world or that I date. When I go on those dates, what do you think is going to happen? You think I'm going to have a great time? You think the people that I date are going to be like, oh, you don't believe, like you have goals that are completely incompatible with me? Let me change so that I can make you happy. What do you think that person is like on a date? Do you think that they're going to have fun? No, of course not. And then what do they end up doing? They end up blaming the people that they date, right? I'm incompatible with the world. I am what I am. And so this, in the same way, like when it comes to your job, if you hate with every fiber of your being, every single job that you've gone to, right? Because if you've tried tons of jobs and none of them work for you, what do you think is the common denominator? Is it the job or is it you? Clearly it's you. And this person even says it. They're like, I'm incompatible. I don't want to do this. And therein, a subtle thing I think could be happening, which is that the jobs that you engage in have a healthy amount of nocebo effect. You're going into it kicking and screaming, so you're not going to have a good experience. And that's kind of like, but wait, that doesn't sound, wait, so you're telling me I just have to learn how to enjoy some crappy job? And that is the solution to happiness? That doesn't feel right. Right? Isn't it like, aren't I supposed to have self-determination and build the life that I want? Shouldn't I move towards my goals? And my goals are like freedom and enjoyment? Sure, absolutely. But I think that there's something here internally that you can adjust. Because I think if you really think about it, there's something subtle going on here, which kind of goes back to this issue of jealousy. Which is, what do you really want more? Do you want what someone else has? Or do you want to be happy? Because oftentimes when we really, I think it really comes down to jealousy, is we don't want to actually let go of our jealousy, right? You don't, if you really think about it, like, I don't want to have to settle with not having a windfall. I want the world to be fair. I want that windfall. And if I were to tell you, okay, I can give you a meditation practice that will have you be content with what you have, you're not going to do it. You want the windfall. You want what you want. You don't want to be happy. Screw that. I don't want to settle. I don't want to be content. You want what you want. You want the windfall. You want the lives that they have. I don't want to be content with this. And therein lies the problem. Because you actually you don't want to be content. You want something else. And if someone goes through life without prioritizing contentment or happiness, this is exactly what you're going to see. Why aren't they happy? Because they don't want to be happy. What they want is what someone else has. So I don't know if this is rubbing people the wrong way or if it's sinking in or even if I'm making any sense. From a very practical perspective, there are a couple things to consider. The first is if you don't like any of the jobs, I'm not saying that you should just learn to be happy there. I'm saying that if you value freedom, you should make a concerted effort to move towards your values. And what that means is oftentimes sacrifice. So I'm not saying you should just be content with your job. You should work on that angle a little bit. But also, what are the jobs that are the most tolerable? What are the jobs, okay, if you have to work 8 to 10 hours to have this amount of free time, can you get paid twice as much? Therefore, you have to work half as long. So instead of sacrificing 8 to 10 hours, you will sacrifice 4 to 5 hours a day. Is that possible? Now, this is where a lot of people say, well, no, it's not. That's where I'd say, I'm not so sure about that. It's probably possible. It's, are you willing to make the trade to accomplish it? Well, no, because I don't want to go to school. I don't want to do that. I don't want to do this. So I'd say very practically, by all means, try to optimize your life towards freedom. If you care about freedom and that's what you find fulfilling, that's a wonderful, I don't think it's a goal. I think it's a value. And so then your goals should be determined by that value. So if what you care about is the freedom to do what you want to, your goal should be, how do I create a life of freedom for myself? Because I don't really accept that there's nothing you can do to improve your financial situation, that you can't get some kind of advanced degree, that you can't, save up for whatever. there's going to be some kind of plan. Now you may be wondering, well, why is it so hard? Or not, you may be wondering, but I think there's a reason why it's really hard to think that way, which I don't blame anyone for if you're kind of in that situation. And what is that reason? It's because of the windfall. So when you look at someone else and you're like, they didn't have to do that crap, why should I? Right? They just got it. And that's what I want. Why? How is it fair that you're telling me that I have to work my ass off, get an advanced degree, double my income, grind for 5 years so that I can work 4 hours a day and maintain my current lifestyle, and someone else over there just gets the windfall and they don't have to go through all that crap? How is this fair? That I have to adjust my goals, I have to do internal work when other people have it easy. And this is where the simple thing to say is, it's not fair. Right? Sorry, life isn't fair. Which is sort of true and sort of not true, to be honest. That's kind of a weird thing to say, I know. But what I really encourage you to do is really think about the jealousy, because really what's getting you hung up, if those people didn't exist, I want you to just think about this for a second. If there were people around you that did not get the windfall, then what would your life be like? Would you be happy and content? Would you be moving towards your career and advancement and all that kind of stuff? Think about that, right? If there was no jealousy and you could just focus on building the life that you want to and moving towards your goals. If there was no one around you that when you looked at them, you were like, oh, that person is so lucky and I'm unlucky. If we could remove the unfairness from the equation, in your head, how would that change the way that you look at life? Because it's transformative. Because then what happens is when you talk to people who are not jealous of other people, they're just living their own life, right? They're like, oh, it's great that someone else has something, but I'm in this situation, I'm going to focus on me. I'm going to try to figure out how do I work 4 or 5 hours a day. And that's really what you need to do, right? You need to start living your life, but you can't because of the jealousy. Because every step forward you take, instead of thinking about how many steps you need to take or that it's progress or that's moving towards your values, all you're looking at is you're looking at the one person who's at the airport When you're walking and you're lugging your bags and that little cart drives by with two people sitting on it, and you're like lugging your bags and they're just taking a ride and they're like beep, 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 and they're like weaving around people and everyone moves out of their way, right? Because it's a friggin' airport cart. Oh, why don't I get to be on the cart? I get it. Like, it makes sense. Like, jealousy is such a natural emotion. And yet I don't think that wanting to be on the cart helps you in any way, shape, or form. In fact, noticing the cart and focusing on the cart, all it does is makes the road that you have to walk actually artificially worse because you're thinking about the cart. You got to carry your luggage, whether they're on the cart or they're not on the cart, right? You got to carry the luggage. You got to walk to your gate no matter what. And that's going to suck a certain amount. I'm not saying it isn't. What I'm saying is that if you want to start living towards like your goals and building the life that you want to, jealousy has no place. And I think they're right when they say comparison or jealousy is the thief of joy. And like, I don't know how to say this, but you're never going to live a fulfilling life and find joy if you're chasing what other people have. This is the big discovery that the yogis made in the East, is that the satisfaction of desires does not lead to happiness. It can lead to temporary enjoyment. It can lead to positive emotion and pleasure, but it doesn't lead to contentment. And this is also what Maslow discovered, right? So he was like, okay, so there's like food and shelter, and then there's like other kinds of psychological needs, and at the very top is self-actualization. And so if you're in this kind of situation where you're looking around and sort of saying, okay, the world is unfair, I want you to first think a little bit about your jealousy and like where that comes from and why it's so hard to let go. The other thing is, by all means, plan for a life, like advance professionally, but don't grind because the world wants you to grind. This is another important thing where it's like, I don't want to be a corporate slave for the man. Then don't be a corporate slave for the man. Work in the corporation for yourself. Do it for you. Right? It's kind of like when people talk about quiet quitting. Quiet quitting is when people stop going the extra mile. That's not quitting. That's called just doing your job. So by all means, go to work and just do your job. Or more importantly, like this is what I really recommend, is when you go to work, go for yourself. Start doing things for yourself and don't worry about what other people are doing because it doesn't help you at all. And so think a little bit about where that jealousy comes from. And the last point that I want to share with you is people may ask, okay, so like, what do you think, Dr. K? Is the world fair or unfair? And this is what I'd say. I have certain beliefs, but the most important thing about this discussion is not what I believe. It's for you to figure out what you believe and to find your central compass. Is the world fair? Great. At least now I understand it. Or even if you decide the world is unfair and then you say, okay, the world is unfair and I'm going to do something about it. That becomes a goal to fix as opposed to something to be resigned about. And one thing that I can guarantee you is anytime a human being reconciles their place with the fairness of the world, good things happen. We're not saying it's fair. We're not saying it's unfair. The important thing is for you to determine your relationship with the fairness of the world. And for even if that means, you know what? It sucks. I am unlucky and they are lucky. And to accept that and say, okay, what am I going to do about it? How do I succeed in a world that's unfair? That can be incredibly empowering and incredibly healthy and lead to a lot of success. Or to say, you know what, the world is fair. And instead of focusing on their windfall profits, I am ignoring all of the things that I actually have that are like my advantages. Because that absolutely happens when you engage in jealousy. When you look at other people's lives and you're like, this person has A, B, and C, it's very easy to forget that you have D, E, and F. And I'm not saying that the point value of both of those things is the same. But it's so easy to lose sight of what you have in your corner when you're looking at what you don't have, right? Because it's not what I've got in my arms, it's I'm looking out there. And naturally, I look at the things that I don't have because those are the things that I don't have. And then we forget about what's here. And then despite the fact that I've actually got stuff, all I see is unfairness in the world. Which is like, that's going to create problems. So it's a really common issue that we think, oh, like I'm incompatible with the world. And I'm not saying that that's fair, and I'm not saying that you aren't. What I'm saying is if you really want to stop being that way or improve your life, like I don't know how to say this, like there's a component that you control. There's absolutely a component that you control. Is it fair that you have to control it? No, it's incredibly sad. It's incredibly sad. And I've worked with patients who have been through traumatic experiences. And they can look at other people and be jealous. Like I'm so jealous of, my friends who are able to engage in healthy romantic relationships, and my trauma is so bad that it's so hard for me. And when I sit with those patients, I don't say, well, you've got these advantages. What I say is, yeah, it is unfair. What are we going to do about it? I'm so sorry that you had a life that this happened to you and that there's been this much psychological damage done. Is it fair? Absolutely not. Are you unlucky? Absolutely. But what you do from this day forward is still your choice. So what are you going to do about that unfairness? Are you going to say, oh, like give up? Because sometimes my patients do that. Right? And I don't even blame them. And yet it's my job to help them stop giving up. And it's their job to help themselves stop giving up. Because once you've given up, once you've decided my goals are incompatible with the world, that is an you've created a problem that is not solvable. And in doing so, you've doomed yourself to failure. So there is some internal component there that you've got to work with. I'm not saying it's fair that you have to do it. It's not fair. It's just something you got to do. Or you can choose not to do it and continue living the life that you want. And that I don't want for anyone in this situation. Because the bizarre thing is when people start working on it, I've noticed that things get better. Like it's kind of weird. But sometimes they get better in spite of you, right? Because you don't want to have to work. And I get it. Like, I don't know if I'm kind of speaking too much here, but like, you wish that the world was in such a way where you didn't have to compromise, right? That you didn't have to do that work. You didn't have to do all that extra stuff. I get it. But this is the world that we live in. And do I wish it was different? Do I wish you got your windfall? Absolutely. But be a little bit careful because I've worked with people who have gotten windfalls. And you'd be surprised at how similarly they feel with you. Questions? Okay, so someone's asking, Elder Hero 1 is asking, do you need to pursue a dharma to live a fulfilling life, or can you just live a simple life and find true contentment in that? Great question. So you can live a simple life and work so hard internally that you can find contentment in all things. You can do that. It ain't easy. And I wouldn't recommend it. So honestly, if you're trying to figure out, okay, should I live my dharma or should I be successful? Should I be content with what I've got? I would honestly say the right move is to climb Maslow's pyramid. So I honestly recommend everyone that I work with to become professionally successful, physically healthy, get a roof over your head. By all means, chase materialism. Become wealthy. And then when wealth isn't enough to make you happy, then you will truly discover spirituality. Right? So it's like back in the day, I was ready to become a monk. And I said to my guru, I said, I'm ready to forsake my life, bro. I want to devote myself for the pursuit of eternal contentment and happiness. And I want to cast off the suffering of the world. I'm ready to give it all up. And he turned to me and he was like, bro, you ain't got nothing to give up. You're a failure in life. You can't give up nothing. So he turned to me and he said, go become as successful as you can in the material world. For the next 9 years, succeed as much as you can. Build as much as you can. At a minimum, get a doctoral degree. And then, when you've actually become successful, when you've climbed the first 4 steps of the pyramid, then come back, give it all up, and shoot for number 5. So can you? Sure. I wouldn't recommend it. At least that's what my teachers told me, and that's the path that I walk. So then, what do? I try to become successful. And I put 100% of my energy into becoming successful. And as you put 100% of your energy into becoming successful, that's when you get to struggle with ego. You'll get that? If you want to conquer ego, and this is sort of an egotistical statement, I mean, you can conquer it anytime. But boy, it's in some ways, way harder to conquer ego when you're successful than it is when you're a failure. And it went to my head it feels like the bosses are getting harder the more materially successful I become. Because they're getting harder in a weird way. They're getting more subtle. Right? So even now, as I'm saying this thing, I've got this part of me that's wow, this statement is egotistical. Because now you're making a comparison. You're telling everyone, it's harder for you than it is for them. And you see how sneaky it is? That's my ego. So I've got to catch it. So I think that if you want to pursue your dharma and live a fulfilling life, start by becoming materially successful. Start by succeeding in life. And enjoy everything that life has to offer. Because when you enjoy everything that life has to offer, when you live in the house of your dreams, you have the relationship of your dreams, you have the clothes of your dreams, you've got the gaming rig of your dreams with a specially designed case because your video card is the size of a video game console. And you wake up to your perfect life and you're I'm still unhappy, that's when you will really start looking for happiness. But the problem... So this is kind of an interesting story. So in India, there are some people who are considered to be enlightened, right? So Buddha is one, Krishna, Ram, these are essentially the gods of India. And in India, there are 4 castes. There's a caste system. So they would divide society into 4 tiers. At the top tier is the Brahmin. Beneath that is the Kshatriya. The Brahmin is the priest. The Kshatriya is the king. Below that are the Vaishyas, which are the merchant class. And below that are the Shudras, which are the laborers. Okay, so we've got priests, kings or nobility, merchants, and laborers. So let me ask you all a question. So the priests are the most spiritual. They're the highest caste. They're the instructors and teachers of meditation. Guess which ones attain enlightenment? What do y'all think? Where does enlightenment come from? Are the experts in meditation the ones that are becoming enlightened? Kings. Actually, kings. Traditionally. There are a bunch of laborers later on. So people have wondered, why is that? So here's the thing. The priest travels to the king's palace, wakes up in his hut, because I'm immaterial, right? I'm beyond material things. I'm going to wake up in my hut, my straw mattress. And I'm going to walk down the street to the palace, where I'm treated with respect and as a guest. And I teach the king the wisdom. And the king is sitting there, offers me food and drink. It's what will you have today? And I'm I'm okay. And the king is all right, I'm going to eat a couple donuts. And I'm okay, I'll have rice porridge. It's fine. Because I'm immaterial. Then I sit there, I watch the king eat his donuts. I'm going to teach him about spirituality. He's wearing his fancy clothes, sitting in his comfy chair, gives me a seat of honor. And at the end of the day, I leave the king's palace. I walk outside, I walk down the street, I go back to my hut, fix myself a meager dinner, do my own dishes, and go sleep in my straw mattress. Get up the next day, rinse and repeat. So what happens with the Brahmin, I can meditate as much as I want to, but there's this tiny little seed of like, why the F do I only get treated like a boss when I'm a guest at the king's place? Why can't I be the king for once? And then I can get it whenever I want to. I get that I'm treated with respect, but it's not mine, it's his. And all of the best things in my life come out of the charity of another person. It's not mine. And that seed of doubt makes it so that Brahmins don't become enlightened. Whereas the king gets the donuts, has a lovely queen, subjects who like them, rides a first-class elephant, none of this coach business. Brahmins walking home, king's riding an elephant. GG noobs. And then one day the king wakes up and he's unhappy. So then he looks around and he has all of his desires fulfilled, but he's still unhappy. So there's a desperation for spirituality. It's not, how do I become spiritual? It's like, oh shit, nothing works. I've fulfilled everything. Like, there's nothing left to chase. Right? Because even in this post, this person is like, oh, if I had money, I would be happy. If I had this, I would be happy. If I had this, I would be happy. I can tell y'all, having worked with these people, yeah, you're absolutely. You get your windfall. A year later, you're not going to be content. You're going to want something else. Because that's the nature of desire. Like, desire is like, I don't know if this makes sense, but you don't have to have a windfall to understand this. I want a cookie today. Cool. Have the cookie. Satisfy your desire. You're looking at someone else, they've got a cookie. Why don't I have a cookie? I'm like, you know what, bro? Totally fine. Or girl, totally fine. I understand that they have a cookie and you want the cookie. I'm going to help you out. I'm going to be a windfall for you today. I'm going to bake you a cookie. Here you go. Warm chocolate chip cookie, cold glass of milk. You enjoy it. The person's like, great, I had a windfall. I eat the cookie. I enjoy it. It's delicious. I'm happy. I'm content. Oh my God, ice cold milk, warm chocolate chip cookie. Let's go. What happens tomorrow? How long does the happiness of satisfying your cookies last? Satisfying your desires last? I'm going to have another one. I want another one. And every single time, how many promotions does an investment banker need to get to be happy in life? The answer is one more. It's the nature of desire. You don't have to be an investment banker. You don't have to get windfall profits. All you need to do is eat a cookie. You can understand this. And so then the question is like, why, like the handful of human beings who become enlightened, that there's all kinds of caveats to this. I'm simplifying. Why are they the kings? Because they're the rare specimens that when they want something, they get it. And then they get it, and then they get it, and then they get it, and then they get it. And then they're still not happy. And then it's like, what do I chase if I've got everything? What happens when I have no one to be jealous of, but I still feel uncontent? Because we assume that the more I'm jealous of someone and the more I get what they have, the happier I'm going to be. But that's not how it works. And so when I have no one left to be jealous of, and I'm like, oh my God, I'm still unhappy, then I start crapping myself. And now you also see why celebrities are so unhappy. Because they don't even have anything to strive for. Because they have it all. And yet they're unhappy. And then we blame them for that. You know? It's just what it means to be human. You can chase your desires until the end of the earth. They're never going to bring you sustained happiness. Killface is saying, but do you need to work hard or do you only need to have it all? What a great question. Okay. So let's talk about this. So the question is, do you need to work hard or do you just need to have the fruits of your labor? So let's think about this, right? What do y'all think, first of all? Do I need to work hard, or do I just need the fruits? What's the important part? The labor or the fruits of the labor? Okay, so let's think through this. What happens if I work hard and I get no fruits? That's kind of sus. Like, no one wants that. Man, I tried so hard. So I'm struggling to find love in this world. And people said, work on yourself. I logged onto this. Dr. K was telling me to work on myself. So I worked on myself. I got into shape. I got better professionally. And I'm still lonely. That doesn't feel good. And then there's the people who have the windfall, right? That's like pretty sweet. Nice to have the windfall. So let me ask y'all something. This is a question for the gardeners out there. So let's say I plant a tomato seed. I water it every day, it turns into a tomato plant. Nurture it, care for it, it starts bearing fruit. Tomato fruit. I guess it's tomato, right? We don't call it tomato fruit. And I eat that tomato. How does it taste? I go to the grocery store, I buy a tomato. How does it taste? Which one tastes better? So most people are saying the one you grow. Right? The one you grow. Then there may be biological reasons for that. So there's some evidence that growing tomatoes with lots of fertilizer changes the rate of uptake in the development of like certain flavor chemicals. So homegrown may taste better for that reason. I can also attest, I don't know if y'all caught this interview, but I grew peas and lettuce, and my lettuce tasted like crap. The stuff at the grocery store tasted better. And the reason is because it's too warm to grow lettuce where I live. So apparently when it's too warm, it turns bitter. But generally speaking, effort plus fruit is better than either of the other two. Just effort with no fruit feels bad, man. And feels better to just get stuff. Can feel nice for a while. But the effort that we put in does appear to correlate with the enjoyment that we get. And the more that you tunnel down into that, the more that you realize, like, it's not just the effort that you put in. It's the way that you approach the thing afterward. So here's the other thing that I'd say. So let me put it this way. If I grew a tomato and it was mediocre, I'm pretty sure I would enjoy that tomato more than a mediocre tomato from a grocery store. You know? Like, does that make sense? You're like, you know, the tomato's not the best, but I made it. I grew it, which is really, that's the secret. See, everyone thinks about all the others. That's the thing so that once you understand that, you'll like be halfway to enlightenment. You're so much more forgiving for the stuff that you've put effort into. So much more judgmental from stuff that comes from the outside. So AFK, obvious. I think I disagree on that one because you can feel disappointed on all the effort for a mediocre tomato. Brilliant, AFK Abby. So, what determines whether you're disappointed in the tomato or happy with the tomato? Now we're going to come full circle. Secret to enlightenment today, brought to you by AFK Abby. Pink sausage got it. Look at y'all so fast. Expectation. Oh my God, I put in so much work and it's only this good. I'm so disappointed. I put in so much work and it's only this good. Disappointment can only come with expectation. Give y'all an alternate. Hey, chat, let's grow us some tomatoes. I ain't never grown a tomato before. I have no idea what it's going to taste like, but I hear tomatoes are good. It's a global pandemic. Let's plant some seeds. Let's go. All right. What's going on today? Okay, I'm watering it. Am I watering it too much, too little? I don't know. Now there's some tomatoes coming. Can I eat them yet? Okay, let's try this one. Ooh, that one tastes awful. Ugh. Yeah. Let's wait a little while. Okay, this one tastes a little bit better. This one is like, all right, not the best tomato I've had, but hey, look, we grew this little tomato. We're going to name each and every one. Attitude. Expectation. Y'all get the Adios Prime. Thanks for stopping by. Great to meet you at TwitchCon, by the way. Y'all good? Does that make sense? So AFK Abby isn't wrong. So this is the thing I want y'all to understand. When Dr. K says something in response to your question, doesn't mean you're wrong. In fact, you're right. And so if that's your experience, that needs to be tunneled into. Does that make sense? Like we talk about, someone was asking me, do I enjoy the wisdom of Sadhguru? Sure. But the big thing that I've learned is you don't need the wisdom of Sadhguru. You don't even need the wisdom of Dr. K. Y'all actually have all the data that you will ever need. You just have to pay attention to yourself. Because it's in there. You don't need Sadhguru or myself to tell you that the satisfaction of desires will not bring you to happiness. All you need to do is eat a cookie and see what happens. Nope. So Fizzy Knight saying, can't trust myself though. Great point. Right? Because let's be honest. There are teachers. And if it was so easy, then teachers wouldn't exist. Excellent point. So then the question becomes, when can you trust yourself? What makes it that you can't trust yourself? A great question. So see, these are all the right questions. These are beautiful. So Uber Trash Cat, Uber Trash Cat is asking, why do expectations exist if they are so bad? So this is very important to understand. What does evolution select for? Really important to understand. Alfredo Tomato. Oh my goodness. Thank you. Survival. Evolution does not select for happiness or contentment. It selects for survival. So the road to happiness or contentment is almost against a portion of our nature. It's not quite against a portion of our nature, which there's this more complicated mental gymnastics that you have to do. But so this is the struggle of being human. This is the struggle of being us, right? And this isn't just about contentment. This is also about technology. So our brains were designed to accomplish a particular thing. But that's not happiness. And so that's the crux of so much of this stuff. Twitch Granny is saying going with your gut isn't always a good policy. Completely agree, but going with your gut depends on how refined your gut is. Someone's saying, can I quit? Drop me stuff saying, can I quit being human? I don't like it very much. I wouldn't recommend it. I would go as far as to say that if you don't like it, chances are you're not using it right. Dr. K, will you give up your achievements to become a monk? Maybe. But I don't think that giving up my achievements is something that I try to do on a daily basis. And I'm trying to become a monk. I don't know if that makes sense. Are you so likable because you are content? I don't know. Scott, yes. That's a question for y'all. Let me tell you. Okay, I'm going to answer this question next. Why is Dr. K so likable? I'm going to tell you all the reasons why people love me so much. Okay, it's going to be great. It's because I do this, and then I do this, and then I do this. That's why everyone loves me. If you need instruction about how to love me more, tune in on Wednesday. We're going to do another stream about how to love Dr. K. Welcome, everybody. So here's what I realized that was kind of a meme, but honestly, like, I can tell you why I love streaming. So what I love about our interactions is when we get to be us. And so what I try to do is be me. And what I love about y'all is when y'all are y'all. And that's what's great. And I think it's not anything like, I don't know if this makes sense, but do you guys get that I live off of you, right? So it sounds parasitic, but you know, like, this is not, do you guys, y'all get that? Like, I've been streaming for an hour, right? And everything that is coming out of my mouth is not, this sounds so bad, has to do with y'all. So I think what attracts human beings to each other is connection. But it's a two-way street. All right, so Leafs fan 1999 is saying being authentic. I think that's what we strive to do. Can we vote to bring the cult totem back? One day, sure. Okay, oh my God, it's 2:30. Crap, we were supposed to meditate, but it is, I gotta go. Vibing with chat. Okay, let's meditate for a couple minutes. What kind of meditation do y'all want to do? Let's meditate. Come on. Koji Korma was saying, I told you midway that you were past time, Healthy Gamer GG. Thank you very much for looking out for me. I appreciate it. You're too kind, my friend. Y'all really want to do Zazen? Y'all want to do a Zen meditation? We haven't done much Zen meditation. Okay, we'll do Zen meditation. Let's do it. Let me think. Okay, hold on a second. We'll do Zen meditation. All right, so this meditation is going to be hard. So we're gonna do a Zen meditation. But I need y'all to be in 100% with the meditation before we do it. Okay? So your mind is not going to want to do this meditation, but it needs to do it. Okay? So what we're going to do is, I wonder if there's some, I can't zoom. I want y'all to watch, we're going to watch this rock grow. Go. Watch it grow. Okay. So I know y'all think you're all that. But if you are saying, oh, it's not growing, a rock can't grow, you're not watching closely enough. If you watch it closely enough, it'll grow. Look for the growth. Look for it. That's blurry. Look, chat. Watch it. Stare. You can go find your own rock. You can't be memeing and doing the meditation at the same time. Watch it grow. So this is where, for those of you that are thinking, oh no, like it's not growing, like Dr. K is just saying that. It's like, it's a koan. No, it's growing. Look closer. Yeah. It's okay. Chilling. We're just watching a rock grow. Look carefully now. Don't give up. Watch it grow. Watch carefully. Mad Mathesis is saying, I'm having a difficult time because I think most rocks usually shrink because of erosion. Can I watch it shrink imperceptibly instead of grow? No. You have to watch it grow. Okay. If you all want Zen meditation, that's it. Now, a lot of people will think, oh, but like it can't grow, like rocks can't grow, like rocks aren't alive. Sure it can. You're just not looking closely enough. Look closer and closer and closer until you see it grow. Jackie Chan's is saying why it cannot shrink. I never said it couldn't shrink. But what I asked you to do is, did I ask you to watch it shrink? No. I asked you to watch it grow. So that's what you should do. No, zoom in is not what we asked. Zoom in is, I didn't say look at the rock closer. I said watch the rock grow. It's not zooming. You'll know what growth is, right? Growing and zooming isn't the same. You don't look at a kid who's like 5 years old and like look right in their face and they're like, wow, Timmy, you're so much bigger now. Watch it grow. Here's the thing. So for those of you that are logic chads, you're going to be thinking to yourself, ha ha ha. The rock doesn't grow. Ha ha ha. Meh. That's not how it works. Meh. Rock doesn't grow. It's impossible to grow. Ha ha ha. So this is what I can guarantee you 100%. If you watch it for long enough, you will see it grow. 100%. And if you haven't seen it grow, you just haven't watched it long enough. Is it literally like hallucination? Just keep doing it. You'll see. It's like, try this. It's spicy. What do you mean it's spicy? Just try it. You'll see what I mean. What is spicy? Just try it. You'll see what I mean. Keep watching it until it starts growing. Can it be any other object? No. Has to be a rock. So Marcus Platypus is saying, I'm confused. What do I have to understand? You don't have to understand anything. You just need to watch it grow. Rogue Swan is asking, can it be any rock? No, it can't be any rock. It has to be the right rock. How long is enough? Until you see it grow. What is the right rock? You'll see. Keep trying with different rocks until you see it grow. Then you'll know you have the right rock. It's like asking y'all ask me what food will I like? I don't know. Try different things. Why do people make it so difficult, Grandma Lancaster? I don't know. It's not that hard. You'll find a rock. You watch it grow. If it's the right one, it'll grow. Okay, who are we rating? Amazon Sucks is saying, my rock shrank. Does that mean I'm doing it wrong? Yes, that means you are doing it wrong. I don't know how simple I can make this. Watch it grow. Don't watch it shrink. Like, no, I mean, I'm not trying to be... It's like, what... It's like, hey, open this book. And chat is like, I closed the book. Did I do it right? I'm like, no, open the book. Like, no. That's not right. It's like, raise your right hand. I raised my left hand. Did I raise the right one? No, you raised the left one. Okay, we can raid... Y'all want to raid Bobby Scar? Let's do it. Just practice, y'all. Watching a rock grow is not easy. Just practice, 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 and you will see it. Okay? We'll see y'all on Wednesday. Oh.